guys, Lauren here with Bizrok. In today's video, I want to talk to you about what's probably the most important part when it comes to communication and presenting treatment plans to your patients. Guys, it starts with us. It's about being what I would call a confident communicator, which, let's be honest, how many times have we rolled into the office, we're running late, we overslept our alarm clock, we're coming in hot, we miss part of the huddle, and then we start our day and we start going through the motions. Guys, let me ask you an important question. When you do that, when you start your day that way, is that really you being the best version of you for your team and your patients? The answer is no, right? We're more confident whenever we get up early, we get up on time, and we walk in the door and we're ready to go and we're prepared and we're not rushing around. See, that's actually where confident communication starts, is how proactive we are with our day. So that's step one when it comes to confident communication, okay? The second part of that is truly believing in your dentistry and the type of work that you provide for your patients. Whether you are a doctor or a team member, do you believe in the type of dentistry and the dental services that you provide your patients? Patients can feel that. Patients can feel if you are not confident. So if you are presenting treatment options to your patient, do you tell them and guide them on the best option for them, or do you give them 15 options? Guys, if you're giving your patients too many options, that doesn't show confidence. If you are the main provider, the doctor that's watching this video, hear me out. Let me ask you an important question. Do you always know the best treatment plan for your patients? If you're an incredible dentist, my argument is you probably do. You probably know the best hands-down treatment plan for your patients. Now, patients like options, and as clinical professionals, you should give them a couple options. But guys, if you are confidently communicating to them, you should tell them your best recommendation. So yes, you might give a couple different options based on some questions that you're asking the patient and guiding them to some different solutions. But at the end of the day, one of the best lines that you could ever say to your patient is, you have option A, option B, but my clinical recommendation for you is that we do this option, and here's why. See, that exudes confidence to your patients. When you're telling them your clinical recommendation, that creates confidence to them, and they're like, okay, this doctor is treating me like a friend or a family member, and they're telling me their best recommendation. Take dentistry out of it for a second. Imagine going to a cardiologist and your cardiologist is presenting multiple different options, and you're like, oh gosh, I don't know. I'm not the expert, right? But oftentimes in the dental space, we're like, no, you know what? Our patients want options. They do to an extent, but if you're the expert in the room, they also want your clinical recommendation. Just like if we went to see a cardiologist, we want the cardiologist to, hey, tell us what to do, right? Same thing in dentistry. So whenever you're confidently communicating, there's a few things that I want you to do also with your body. It's having your shoulders back, presenting yourself in a confident stance. That allows you to walk into the room with confidence. How you look, how you dress. And guys, I don't care if you're wearing scrubs or dress clothes. Every doctor's totally different. And quite frankly, I don't have an opinion. Be you, be the best version of you. And if you're more confident in scrubs, by God, walk in there with scrubs on. Just make sure that they look nice. They look presentable. You have your name listed on your scrubs. I like that much better than a magnet, right? It just shows confidence. It shows that you paid a little bit more attention and you were intentional about your dress attire, right? But walk in with crisp scrubs and clean shoes, ready to greet and serve your patients with your shoulders back. And then most importantly, guys, make eye contact with them. That's how you exhibit confidence when you're communicating to your patient. So those few small things, guys, will start to create belief and rapport with your patients, because at the end of the day, them believing in you is the single greatest factor to whether or not they move forward with treatment for you. So guys, as always, our team is here to help and support you. So if you need help, reach out to us, send us an email. Otherwise, guys, we can't wait to see you and serve you soon.